This program is part of ANCOR's 2020 annual conference, one of many opportunities offered to ANCOR members throughout the year. ANCOR is the American network of community options and resources. Learn more about ANCOR and explore membership benefits and options at anchor.org. We hope you enjoy today's session.
Good afternoon, everybody. My name is Marie Campos, and I am ANCOR's Education Director. And on behalf of the entire ANCOR team, I have the honor of welcoming and thanking all of you for joining us for ANCOR's 2020 Virtual Annual Conference. Before we begin, I do want to share a few housekeeping reminders. We are offering closed captioning during this session. To enable the closed captioning, please look at the closed caption function on your Zoom control panel and then select Show Subtitles. We will be using the Q&A feature to manage the questions for the presenters today. And as always, we will be sharing a recording of the presentation slides and the recording after the event. So just please keep an eye out for a notice from the ANCOR team when those materials are available. And with that, I'd like to ask Robert Budd, CEO of Family Residences and Essential Enterprises in New York and President of the ANCOR Board of Directors, to officially open our virtual conference. Robert?
Good afternoon, everyone. First, I hope that you and yours, both personally and professionally, are all coping well during these unprecedented times. I have the honor of being the current president of the board of ANCOR, as well as the co-chair for the foundation's Included, Supported, and Powered campaign. And I am so grateful for the amazing talent of our ANCOR team and also the equally amazing colleagues on our boards. During these unique times, we have extra appreciation for the talent, dedication, and passion that each team and board member brings. The attention and traction in the fight for our vital resources has been exemplary, and but for the passion of our ANCOR heroes, I fear where would we be right now. As a New Yorker, Barbara Merrill, our CEO, suggested that people may appreciate hearing an update on what's occurring here by an ANCOR member. I can share that most of our services are provided here on Long Island, New York, but we have a number in the city as well, particularly Queens, one of the hardest hit areas. Within our network, it is free that is most dramatically affected, where we serve over 1,000 individuals in our residential support area and a few thousand more in an array of crisis, educational, vocational, and crisis community services. We sadly have lost a dozen of our family members already, and combined with our valued team members, we're well over 100 folks who have tested positive. Many are treated as positive without the test because it is still extremely difficult to get people tested. We have seen amazing acts of selflessness where team members volunteer to live in at a residence for the entire period of our quarantine. Plus, there's amazing creativity and passion, ranging from Zoom meetings and dancing and theater rehearsals to making of masks and personal sanitizers and our own food delivery service. We have toiled as personal protective equipment, PPE, dipped under 100 as our 2,400 employees counted on us to get them this needed protection as we awaited deliveries. And we breathed a huge sigh of relief when those boxes came in, and as we celebrated 22 of our 80-plus residences coming to the other side of quarantine. In short, we can give poignant testimony to the fact that our field is full of heroes every bit as inspiring as the stories that we see in the media nightly. We can give many examples of the current need for legislation to include the essential worker pay, bonus pay, PPE prioritization, and the absolute necessity for that to happen now. We are asking that our leaders at every level of government to finally understand that we are vital members not only of the fabric of our local communities, but our health systems at large, preventing hospitalizations, minimizing the length of hospital stays, and ensuring hospital beds are available to all community members. We are part of a comprehensive solution, and that represents one of the very core values of ANCOR itself. I submit to you that there has never been a more important time for our field to be understood, our DSPs and clinical teams acknowledged as the vital professionals they are, and that the funding and PP prioritization that our amazing ANCOR team continues to fight for every day remains an A1 priority. Collectively, we as a field are honored to serve and support, and we must be included, supported, and empowered at all levels. I have the true pleasure of introducing a gentleman I've had the true privilege and pleasure to hear and be with on many occasions over the years. Dr. Al Condeluci has been a leader in community building, human services, and inclusive advocacy work for over 50 years. Holding a PhD and MSW from the University of Pittsburgh, Dr. Condeluci has been the CEO of CLASS, Community Living and Support Services, a major nonprofit community building organization in Pittsburgh, Pennsylvania from 1973 to 2019. He holds faculty status at the University of Pittsburgh in the Schools of Social Work and Health, Rehab Sciences, and is author of 7 books, including the acclaimed Interdependence, The Route to Community, and more recently, Social Capital, The Key to Macro Change. It is a true honor and pleasure to have you with us, Al. Thank you for sharing your expertise and your passion.
Thank you, Robert. It is truly an honor to be here. Let me echo Robert's comments and points about the heroic direct support professionals and really everyone in our field providing supports for full and inclusive community engagement for folks that we support all over the country. And I understand that we have almost 660, maybe 675 folks signed on to this virtual conference. And I would have much rather been with everyone in Miami for the actual conference, but you know, these times really testing all of us, and switching to the virtual conference, just a stroke of genius on the part of the ANCOR leadership and their technical folks. So thanks everyone for signing on. You know, we hear over and over again about the unprecedented phenomena that we find ourselves in. And the talk today really is going. This was intended even before the pandemic unfolded, was to really look at loneliness and social isolation as a phenomena in our work. And this particular conference, however, really allows us to step this topic up and really look at it in times when we're really restricted to connect. And so we'll get to that as we move through. But my intention is to really share some of what we know about social isolation, loneliness, to define and describe, look at some of the more recent research and literature, and then really to turn our attention towards how do we address loneliness and social isolation with the folks we support, and maybe even how do we address it in our own lives. And then finally, really concluding really with some recommendations, ideas, strategies, and suggestions, many that came actually from you, as to ways and means that we can still try to promote people's connectedness, even in the light of social restrictions and social distancing. So let's get right at it. We know that all people, no matter who they are, with disability, not having a disability, it really doesn't matter, various ages, that doesn't matter, even cultural backgrounds really doesn't matter. All people want similar kinds of things. In fact, psychologists have really talked about these as natural, needs that human beings have anywhere in the world. People want to and need to be active in community and to be social and to be with other people, to be productive, to really stay in their own homes. Folks don't want to be institutionalized or separated from their home community. People want to be able to get around. And obviously, all of this is fashioned around relationships because we are social animals. We need each other. And in that regard, this idea of building, maintaining, and retaining relationships is fundamental. Now, we know that when people have satisfying relationships, and again, this is generic, people having satisfied relationships and families who have satisfied relationships, that those folks are healthier, they're happier, they have better cognitive functioning, they actually live longer. In fact, more recent research on life expectancy has now tracked back to relationships and connectedness. That all the things that we've studied or heard or thought about life expectancy are really they're trumped by the notion of relationships being fundamental, and so we know that relationships are phenomenally important, but we also know that when we don't have relationships, when we're limited from relationships or socially isolated, bad things happen to us. And again, this is generic. Whether we're not talking specifically about disability now. We're just talking about human nature, right? So if you're socially isolated and disconnected, you really begin to have these other troubling phenomena that begin to happen. More sick days, lower self-confidence, feeling alienated, feeling aligned, and then literally actually dying soon. And as again, the life expectancy data is so clear on this issue. Now, we also know that over and above this phenomena of social isolation, that there are cohorts of people who are more at risk, right? A lot of recent research, especially with the emerging baby boomers now becoming part of, the elder cohort, have really brought attention to the fact that elderly folks are at great risk of social isolation. Folks with disabilities, of course, and their families are at risk of isolation. And I'm going to get into some of the research and data on that. Single parents or folks that are single, living by themselves, at risk of isolation. Obviously, mental health conditions, ethnic minorities, or anyone who might feel different from the crowd. All of those folks are at risk of social isolation. Now, let me define this, because the two themes of this talk, the two themes of this piece of the conference are on social isolation and loneliness. And social isolation is really a state where a person lacks a sense of belonging or engagement and literally has minimal numbers of people available to them, right? A loneliness can occur in the presence or the absence of social isolation. It's a lack of social intimacy. I give an example. I by all measures, I'm a fairly connected person, both family, friends, that I have a wide array of. But there are times when I find myself feeling lonely. When I travel a lot, I'm by myself, even though I'm in the midst of a lot of people, I can feel lonely. So any of us are at risk of loneliness. Here's another way of sort of shaping or thinking about social isolation and loneliness. is that social isolation is really an objective phenomenon. It can really actually be mapped or quantified. In the work that I've been doing on looking at this more closely, we've been using sociograms and social network analyses to really get a sense of how connected are people, right? And a social analysis, social network analysis actually can list out the names of people that you have some connection with. On the other side of the coin, loneliness is very subjective. It's really felt by people. And a person might have, in fact, a lot of networks of people around them and still feel lonely. Okay? Now, when we begin to look at the data on social isolation and loneliness, it is really, really face-slapping. A study that was done in 2010 by Julianne Lundstedt, who's at the University of Utah, looked and tracked 308,000 people over at least a 7.5-year period. And as they tracked these people, what they discovered was that there is a 50% greater likelihood of survival for people who are connected or have social relationships. And actually that data, when this was published, it was really shocking to public health officials, because what it put social isolation up there with, it actually exceeded the health risks of smoking, the health risks of obesity, and even physical inactivity, the lack of exercise. That literally relationships outpulled that in terms of human survival. So it began to move this notion of social isolation into social determinants of health. Because a corollary of this is really, well, you know, if we know that social isolation can lead to this this vexing amount of people dying sooner, and health-related problems, what does it cost? And so the Center for Medicaid Services really began to look at this, and they discovered that $7 billion a year are lost because of longer hospital stays and not having community support at home. So social isolation is a huge issue that actually has an incredible cost. This data comes right out of Harvard. It's 2020 data, just published earlier this year. So there's a huge both physical cost as well as economic cost. But simply living alone, it might be just as harmful as then feeling like you're alone. So the notion of examining and thinking about people who are by themselves becomes critical to this analysis. Now, as we think about social isolation and loneliness, there's a biological root. And when I was going through the literature on this and looking at it, I was really taken aback by this particular information, because what it really suggests is that social isolation begins to kick in primal elements in our function as an animal, in our functions as human beings. And what it does, this is almost akin to back when human beings were hunters and gatherers, and they went out in a pack, and they sought out food and did hunting in order to feed the tribe. If somebody got isolated or left behind or lost in that process, literally these biological elements kicked in. Inflammation began to accelerate, respiration accelerated, circulation, the nervous system actually began to kick in. And those were done as defense mechanisms to get people back to their tribe. to get them back to safety, because being with other people was a part of safety. Now, one of the things that researchers are really beginning to understand is that if people are rendered isolated or in a lonely state, these kinds of biological issues kick in, and they help in short-term survival, but over time they become incredibly debilitating. One of the sidebars of this really come with the notion of then losing trust in others. It's a biological kind of a feature. And what that actually relates to today is that if someone tries to intervene with someone that they know is isolated or that really is expressing elements of loneliness, oftentimes the person who is isolated or expressing these phenomena of feeling lonely will reject the help. They'll say, no, I don't need this. Go ahead. I'm okay. And that now researchers have begun to feel is a reaction to the biology of isolation. It also is compounded because isolation and loneliness can accelerate depression. And as you can see from this particular slide, depression really increases mortality, and it challenges the cardiovascular system, but it diminishes serotonin and some of the other enzymes so important in functionality, can lead to stroke and heart attacks, and all of these kinds of things get compounded really because of isolation. But this notion of social isolation and loneliness, as I mentioned, when Holt-Lunstad did her study with folks discovering the 50% mortality rate associated with this, health insurers really began to wake up and start to think that maybe there's something to this social isolation issue that we ought to be aware of, and this loneliness issue. And so what Cigna Insurance Company did in 2018 was a very large, comprehensive study, over 20,000 Americans, and they used the UCLA scale, loneliness scale. And I'm going to talk about the UCLA loneliness scale in just a minute, but here's what they discovered after looking at 20,000 Americans, all different ages, in all different parts of the country, with and without disabilities. And they discovered that nearly half of Americans reported sometimes or always feeling alone or left out. I mean, these were incredibly startling numbers to the researchers. They just were taken aback by this. They also discovered that the loneliest generation were the youngest cohort, Generation Z, which are 18 to 22-year-olds. Now, these are the kids that literally you see with their phones on, and they're connecting through texting and through various apps, and yet this generation really indicated the greatest sense of loneliness, and that, interestingly enough, social media use alone was not a predictor in this particular study of loneliness, although other studies have corroborated that social media is contributing to the loneliness phenomenon. But what the Cigna study used in order to begin to garner some of this data was this UCLA loneliness scale. Now, the UCLA loneliness scale was developed in the very late 60s, early 70s, back at the time of a social awakening in our country, right? And what UCLA tried to do, the researchers, psychologists, and sociologists, was to get their hands around being able to measure loneliness, right? Not an easy task. They created a 20-item scale, and it was a 4-point Likert scale with these 4 dimensions, right? 1 being never, 2 being rarely, 3 being sometimes, 4 being often, right? Those were 4 measures. And then they posed these 20 questions asking people to respond, and to try to be as honest and as fair, as clear as they could in terms of how they were feeling. Now, recognize loneliness can actually be an in the moment, right? So there are times when people can be more lonely, and consequently be able to, report that they're feeling more lonely at that time. Now, I just put here 3 items that came from the scale because some researchers have actually shortened the UCLA scale to only 3 items that they think are the primary items to really discern loneliness. Now, if you look at the scale, right, the scale never, rarely, sometimes, often, 1 point, 2 point, 3 point, 4 point, 20 questions, you know that the highest score you can receive is an 80. That would signal the greatest element of loneliness. The lowest score you could get would be 20 points, 1 point for each question. Now, what they did on the 20 items, however, is they had some items that were reversed scored. Now, as a part of this webinar, I created a white paper that's going to be made available to you from ANCOR. And the white paper actually has the loneliness scale. I embedded the loneliness scale into the white paper, and the loneliness scale is in the public domain, so anyone can use it. It's not proprietary. When you get this white paper, you can actually take the test yourself and score it and see where you score. But a score of 43 or higher on the scale really begins to put up some red flags about loneliness. If you score under 43, then that's showing more of a balance in terms of this element of loneliness. So when you get the white paper, and you have a chance to take this, you'll get a chance to sort of see where you're at. Also, you might want to use the scale with the folks you support, getting kind of a feel for where they're at in this phenomenon. Now, Robin Williams, this iconic comic that left us far too soon, said, "I used to think that the worst thing in life was to end up alone, but it's not. The worst thing in life is to end up with people who make you feel alone." I think it's really a powerful insight, that the notion of just being with people is not enough. It's being with the people that you really want to be with, that you feel are, satisfying to you. And so let me just share one other bit of research before we get into then some action strategies that address this. I was part of a study that we did in Pittsburgh just a couple of years ago with Chatham University. And we did this study looking at families who had children with disabilities. And we took 25 families who had children with disabilities, and we took 25 families who had children that were similar, demographically similar, but did not have a disability label. So we had 50 people in our study, 25 who had children with a disability label, and 25 who had children that did not have a disability label. And we used the social capital benchmarking survey to try to measure their community engagement patterns, how engaged were families. And as you might imagine, the 25 families who had children with disabilities engaged far less than the families who had children without disability labels. Right? We weren't surprised by that. We sort of thought that probably would happen. But what we were surprised about was when the qualitative analysis of those 25 families who had children with disabilities and really began to probe, what is it that causes you to engage less or to be more isolated in your reality? And these items that are on this slide were things that the families told us. that there was an economic impact, that it was to engage is costly. And families who have children with disabilities don't have as much discretionary money because disability is a costly phenomenon. Logistical challenges. Families told us that to go out and engage, especially with their children that have disabilities, really require all kinds of, you had to really look at and make sure where you were going was accessible, and was the parking available, and was the bathroom accessible, and all these logistical questions. And I certainly understand this because a couple of years ago, I took care of my dad who had Parkinson's, ultimately passed away. But we tried to keep Dad very engaged in the community, even though his Parkinson's was causing pretty significant disability ramifications. But the logistical nightmare of trying to get Dad out was always a burden for us. We know that folks with disabilities have increased medical appointments, so they don't have as much free time to go out as often or to engage. And then the social stigma was that families reported to us that they felt like they weren't welcomed in community, in engaging in community. And so these phenomena are some of the reasons why people with disabilities and families with disabilities engage less. And engagement is the key bridge to addressing isolation. So how do we address this? What does all this mean for those of us that are providing supports or running agencies or really wanting to see people engaged? Know that we have the final rule that CMS has put on, saying that you're going to have to get people out of separate settings and into community settings, and now 25%, and they're going to increase that. So there's a lot of challenge now about getting people out and engaged over and above the pandemic issues of social restriction, right? So here's my recommendations in looking at this, thinking about it, running an agency for 47 years that provide service to folks with disabilities and their families, is that I think we have to re-examine the root of this problem. I think we have to really recognize that engagement to address isolation and loneliness requires both micro as well as macro strategies, right? So let me share what I mean by this. Change theory suggests that there are only two routes to changing something, right? If, for example, if I want to help my dad engage more, there's two things I can look at. One is, what can we do with my dad, and what can we get my dad to do for himself so he is more capable of engaging, or that the engaging is less burdensome. So that's micro change. And that's the route that typically we do in human services, is we sit with our consumers, our clients, the folks we're serving, and we really try to help people get prepared and understand what's going to be expected of them when they're out and about engaging more in terms of building relationships and social capital. But there's another whole element to this, and it's the macro change agenda. And macro change is exactly what it suggests, that rather than change the person, we begin to say, what has to change in the environment to make the environment more accepting, hospitable, and respecting, right? So micro change is a kind of a clinical phenomena, right? Look at my cousin Carrie, who had Down syndrome. We said, Carrie has difficulty communicating. She can't speak very clearly because of a cleft palate. So maybe if we got Carrie some speech therapy, that might help her communicate a little bit better. That's a micro intervention, right, to facilitate that Carrie can communicate more effectively. And there are micro things we can do around engagement. In fact, here's a list of micro interventions that I think are really worth you taking a look at in your own agency and your own perspective, right? Um, Cognitive behavioral therapy has been something that's been out there for a long time, really looking at you know, the cognition around engagement, um, and and the whole idea of social prescriptions. You're seeing this more and more now in beginning to prescribe social things for people, but assuring that the things that we prescribe are things that will be valorizing and positive. Social fitness exercises. Social fitness exercises are really, in some cases, role playing or practicing some, ice breaking small talk and other kinds of social things that are at that very first element of the engagement process. Conducting a cultural profile, which is essentially examining people's passions, interests, hopes, and dreams, and how that might lead to other people. Mindfulness, which is a micro notion of really just trying to pay attention to what it means. Even the idea of a care force, and a care force being some way of really identifying or pulling out who might be at risk of social isolation, and then really being able to intervene, right? So these are just some micro intervention, generic micro intervention techniques. But on the other side of this coin is the whole macro change agenda. And this is the one that I've really been fascinated by, and where most of my more recent research and most of my more recent writing has swirled around. How do we change the culture? How do we change the social architecture of society to make it more accepting and more respectful of, of folks? And now, macro interventions, here's just a list of some macro intervention strategies, right? And I've used every one of these strategies in the work that we were doing at class, and in some of the work that I'm doing now with the Interdependence Network. But the idea of community mapping is really this notion of really getting a handle on what's out there, both formally and informally, in our communities, in communities where the folks we support live, right? Understanding this and really looking at it. And there's some strategies around actually mapping, using an actual map to plot and identify places of connection. Libraries, community centers, coffee shops, where clubs and groups and associations might meet, space that would be utilized by the general community. Right? Gatekeeping strategies. And a gatekeeper strategy is really identifying someone in the community who can actually, not a human service provider and not a staff member, but somebody already as a member of the club or the group or the association that you're looking to penetrate, and then using that person to help host the new person in. Softening the cultural infrastructure. What this actually means is that society is structured in a way around the most typical phenomena. We represent people who might be unique. They're not always typical, right? So thinking about what might change in a culture or in a community physically, in a generic community setting, that would in fact make it more acceptable. I'm sure there are many people on this call that are familiar with the whole phenomenon of neurodiversity, the movement for neurodiversity. And that's a macro strategy that folks on the spectrum, have really been, promoting, advocates and individuals on the spectrum. And neurodiversity is really about trying to create the backdrop that's more comfortable, like, I don't know, loud noises and bright lights and things that can literally be invasive for a person, for some people on the spectrum, can we soften that? Can we begin to create an infrastructure that is more hospitable and welcoming to everyone? And then there's a couple examples here: the Coffee Connection, community benches, world cafes. These are all macro strategies designed not for human service professionals, but to really focus in on community members and getting them engaged. So let me just flip gears and talk about what's been happening in the United Kingdom, in Britain, and where they've really been testing a lot of these macro strategies. And in 2016, the UK promulgated a commission. It was called the Joe Cox Commission, named after a member of parliament who was brutally, beaten and killed on the streets of her town. Right? And so in memory of Joe Cox, Prime Minister Theresa May, got this commission going to really think about loneliness and isolation, right? And generically to think about it in the UK. And what they actually did then was when the commission report came in, and the commission report was really very powerful in showing the ill effects of isolation and loneliness in the UK, similar to the data that I just shared with you earlier in this talk. And so what they decided to do is Parliament initiated a Minister of Loneliness. This was a parliamentary level position that still has been out there addressing loneliness. And they had three major goals as a society, right? This is macro as it gets. One was to try to reduce the stigma associated with loneliness. Because it is stigmatic. If you tell people you're lonely, they think that you're weaker, you're lesser, you're not that smart, you're not that savvy. So people don't talk about being lonely because they know that there's a stigma to it. So UK is really trying to address this and lessen the stigma. And they're making loneliness really a national agenda on their docket, and then trying to improve the evidence and the data to really measure and take a look at, are they having a collective macro impact on creating a more hospitable society. So they've been doing a variety of programs since 2018, social prescribing, where they use link workers. They literally identify people in community who might be at risk of isolation, and literally have a person designed to almost like a case manager might do, to really try to get that person more connected. They recognize that transportation is a big barrier to people connecting. So they're really looking at volunteer car services, and they're developing social hubs. They're really reimagining space. So they're really doing some unique things. And when you see the white paper, I have a whole section on some of the things that are done in the UK. So let's flip gears and really now try to make sense of what all this means. It's a lot of information thrown at this notion of loneliness and isolation. But literally, at the very core of having, a notion of beginning to address isolation and loneliness is through human conversation. Literally, conversing with someone is at the very, very core of all of this. Because it's not our differences that divide us. It's the judgments we have about what we see or what we think that divides us. And so this really moves us into thinking about the antidote to loneliness and isolation, which is building social capital. Okay? Social capital is a phrase used to describe the value we get from our relationships. Now, I already mentioned earlier in this talk that people who have more robust relationships, or they have more social capital, those folks are healthier, happier, they live longer, they're more pro-social, they have a greater sense of others, right? So building social capital, to me, becomes the key ingredient in addressing social isolation and loneliness, no matter who the person is, whether it's a person that happens to have a disability, whether it's an elder, whether it's the person on the street that just lost, their wife or their husband, right? So there's this notion of then building relationships really gets us to think about social capital. Now, the greatest purveyor recently, now the phrase social capital was coined in 1916. It's been in the literature for a lot of years. And for many, many of those years, it was studied by sociologists and social scientists. And they began to discover all these incredible things that relationships do. But it wasn't until Robert Putnam, Harvard sociologist, began to write about and popularize the notion of social capital that it got into the public square. Putnam says if you belong to no community and you decide to join one, you literally cut your risk of dying in half over the next year. In half. So the notion of joining, of participating, of being a part of things breathed life. Being by yourself, being on your own, being separated from others, that breeds death. So the notion of building social capital is synonymous with building community, and really, I think, has 4 key features to it. I've written about these in some books. Robert, when he did the introduction, talked about my book, Social Capital, came out in 2014. But I actually introduced this material much earlier than that. I started writing about this, in the late 90s, and in my work, really tried to codify some ways we can help build relationships or help people who are isolated or lonely build more relationships. And these 4 steps, are interchangeable. They can work in a whole variety of ways. But the first step is really to identify what is the connector for people, right? What causes somebody to get connected? What are people's hopes, interests, dreams, passions, wishes? What do people really want? And can, through finding that out, can that then create a bridge to a place in community, or step 2 here, where people can get connected, right? So step 1, what are people passionate about or interested in or like? Step 2, is there a commensurate setting that in fact can be the host for that person going across a bridge? Folks in social capital talk about bridging social capital. And bridging social capital is when I take my passion, I find someone else or some group of people who share that passion, and I bridge to them, right? Now, step 3 is really about the social infrastructure. It's like, what is out there? What is important to that culture? How does it manifest? And what about the culture can be softened so that when a person connects in, they feel more welcomed, right? And then the 4th step is finding the gatekeeper, and the gatekeeper is an indigenous person in that culture. A gatekeeper literally is somebody. It's not a human service professional. It's somebody already generically in that group, club, that coffee shop, that library, whatever the setting is, and then getting that person enlisted here. Not necessarily be the friend, but to valorize the person so that other people might be willing, interested, called to connect with that newcomer. And this uses the sociological principle of social influence theory. So this notion of these 4 steps are ones that can be used in a whole variety of ways. For example, I've worked with other organizations that have taken these steps, and they've really started with step 4 by identifying volunteers who might be interested in supporting their agency, Once they recruited a volunteer, then they did a cultural profile on the volunteer, began to discover what does that volunteer like or care about. And then they looked at a match between someone they serve and the volunteer who share something in common, right? So there's a couple different ways that, we can begin to think about this notion of community engagement in order to address loneliness and isolation. Because we know there are various types of gatekeepers. There are some people who are really willing to take social risk, and other people who are much more reactionary and won't take risk. And so, thinking more about gatekeepers and thinking macro about gatekeepers becomes a real possibility. So let's segue now into the notion that here we are in a pandemic, and we're all sitting in our homes or in some safe place, and we're participating in this conference. And so now we have folks we serve sitting at home, sitting in their apartments or sitting in their residencies, and they're stuck there, right? So what can we do? What might we do? And to address this, some of you on the call really met the challenge, because we put out a survey and we asked you to give us some recommendations or ideas. What do you think we could do? What might we do? What do you think would be some ways we can address getting people connected even during social restrictions, stay-at-home orders, social distancing, all these kinds of phenomena that are now going to become a part of they're going to invade our culture, and they're going to become parts of our culture as we get out of this pandemic. So here's some of the things. You really expressed some, there were over 40 people responded with some really cool ideas. We only asked two simple questions. We asked, what might you recommend that would use technology? And what might you recommend that doesn't need technology, right? Because we know that there is a digital divide. Not everybody has access to technology. Not everybody feels comfortable or safe with technology. So having just Zoom as an answer is not the answer for everybody, right? I mean, it's certainly a really viable and very lively opportunity to engage via technology, as well as FaceTime and Skype and other kinds of platforms that allow us to actually see people, use our computer, talk, listen, and engage. I was just at a birthday party for a friend in Kansas City, and it was a Zoom. There were about 30 people at the party. We all had drinks, and we even played a trivia game about the person whose party we were celebrating, where we answered questions almost like in a Jeopardy style format that was designed, and fit right into the Zoom format. So there's some real creative possibilities here, not just with Zoom, but other kinds of apps that you can get, House Party and Talkline, Grass. There's some very cool things out there that you can access, upload, and begin to use. You can take virtual tours. My daughter, who teaches in an inclusive school in Orlando, just took her class on a virtual tour of the American Museum of Natural History, and so there's these virtual things that we can do, even YouTube options where we can discover some things and then utilize those. Again, remember, a lot of this though is isolated. So the notion is possibilities of getting outdoors, sitting on the porch, greeting neighbors as they walk by, even doing community service. There's still, our agency class, we have some folks that are volunteering at the food bank in Pittsburgh, helping out, and of course keeping social distance and being masked and having those other kinds of realities, but still doing their share and participating. Online classes. I mean, you can take a course, you can take a long-term or even a short-term course. Here's even some more ideas: yard games and drive-by parades. People talked about drive-in church services where you could actually use a drive-in format. You're in a car, you're really separated, and being able to engage. Um, Cooperative games. There's a lot of cooperative games that are out there. Again, they require technology and some comfort level with technology. Watching TV, talking about what we're watching, um, joining meetup groups. Now, what's been happening is meetup.com, which is a social networking application that connects people to groups of people who like what they like. And this is generic. This is not a disability service. It's just a generic way of meeting people in your community. But what Meetup has really been doing now is really moving more to Zoom platforms and having Meetup meetings, but doing them virtually. So if you're supporting somebody and they like, I don't know, they're interested in, music, you can maybe look at helping them, assisting them join up a meetup group that is using Zoom to meet up musically. So it's another sort of way of trying to get people connected around things that they like with other people, not just other people with disabilities, but other people in the community. So these are all, ideas that we got. When you see the white paper, and ANCOR will let you know how this is going to be available to you. But in the white paper, I really summarized all these ideas that you put forward in the survey. So I'm going to thank the folks that participated in that process, because collectively, we're making the path by walking it here, guys. There's not a playbook on this. It's things that we have to be creative enough and innovative enough to begin to think about and design. So as I get ready to conclude these remarks, I found this this poster in a that was online. It was going on Facebook, but how to build community during a pandemic, which I thought is the advice to all of us. And this is kind of tedious. I'm not going to read it, but this will be available in the white paper as well for you to take a look at, or you can go online and seek this out. But there are ways and means that we've got to think about our communities and how we make our communities more receptive, more hospitable, more welcoming to all people, regardless of functionality or skill or ability. Because there must be a great beginning to any great matter. But continuing to the end until it be thoroughly finished, that's really where the true glory lie, right? This is Sir Francis Drake talking about exploring, back in 1500. But literally, this is true for us, because the great matter that we're involved in is getting people engaged in community generically to ward off and to lessen the throes of social isolation and loneliness, right? And so we're in the very beginning. We're just beginning to understand this. We're beginning to think about it, to kind of look at it, try to understand it. But we've got to stay with this. We've got to continue on until the end, until people are included and are engaged and are a natural part of the community, until it be done. That's really where the glory of community inclusion lie. And so let me just conclude with a wonderful little story that I found in a book by Margaret Wheatley, and the book is called "Conversations Can Change the World." And Wheatley's whole perspective is people just talk, they can begin to discover their humanity. They can discover their commonality, right? And so this little parable was in the book, and I really was really taken by it. It's called an Aztec Story. It goes like this. A long time ago, there was a great fire in the forest that covered our earth. People and animals started to run, trying to escape from the fire. Our brother owl, Tocado, was running away also when he noticed a small bird hurrying back and forth between the nearest river and the fire. He headed toward this small bird. He noticed that it was our brother, the Quetzal bird, running to the river, picking up small bits of water in his beak, returning to the fire, throwing a little bit of water on a flame. The owl approached the Quetzal bird. He yelled at him. He said, "Brother, what are you doing? Are you crazy? You're not going to put this fire out with just a little bit of water that that this is not going to be enough to put out. You have to run for your life. You have to save yourself. You're not going to put out this fire." The Quetzal bird stopped for a moment. He looked at the owl, and then he answered, "I'm doing the best I can with what I have to save a place I love." It's remembered by our grandparents that a long time ago, the forests that covered our earth were saved from a great fire by a small Quetzal bird and an owl and many other animals and people who got together to put out the flame. This is such a beautiful parable of synergy. It's a parable of our common humanity, our commonality. It's a parable of social influence theory, right? It's a parable to say that if you do the right thing, people will notice and they'll want to do the right thing. Not everybody and not always, but enough to begin to shift the culture, right? To begin to literally create a community where everybody belongs, where everybody's welcome, where everybody is loved and can find love, right? And that's in the end what we're looking to do. We're looking to change culture, not just to intervene with disability, because this challenge is deeper than just that. It's really about opening up people's hearts and having people, not pity, not charity, but just finding common humanity. Right? And so Gandhi said it so many years ago, right? This is a quote that I'm sure you've seen, or maybe you have it in your office. We must become the change we hope to create. Right? If we want an inclusive community, we've got to work to create an inclusive community. We have to be inclusive. We have to begin to ask questions about inclusion. We want accessibility. We want attitudinal barriers removed. We want this community where everybody can be respected and valued. And so, as I wrap up, I just wanted to give you some contact information for me. If any of this is intriguing to you, if you want to dig a little deeper, I would like to invite you to go to my website, take a look at some of the uploads that I have there. My TED Talk on social capital is there. I have short videos about social isolation and loneliness and other things that you might be able to glean. And if I could be any help, I put phone numbers and email addresses. If there's anything further that I might be able to do, or I said anything that we weren't able to really engage in this virtual conference, and we have 600 people or so signed in, so we're obviously not going to be able to do a question and answer in a robust kind of a way. But know that I am happy to react to any thoughts that you might have, critiques or queries that are relevant to this notion of social isolation, loneliness, social capital, and strategies to get people engaged. So I want to just conclude. I want to pitch this back to Marie to do whatever adjusting we need to do. I know that we have a hard stop in about 10 minutes. I don't know if we want to use that time, but let me pitch this back and thank you for taking your time and energy. I know folks are really, we're all engaged with this very challenging time, but you've taken the time to be here today, to think a little bit, maybe to open up your not only your mind, but maybe your heart to ways that we can create a community where everybody belongs. So thank you, thank you, thank you. Marie, let me pitch it back to you.
Dr. Condeluci, thank you so much. I don't know if you've been able to keep up with some of the chatter in the Q&A, but folks have been really appreciative of the information you've shared. And so thank you again for joining us. We have a couple questions. Just to confirm again, we are going to be sharing a recording of this presentation and as well as the slides. And so for folks who might have missed, the technical glitches might have been kind of giving you a little bit of a hard time, you'll have an opportunity to access the recording and just kind of review it again. And as well as the white paper, as soon as that is available, we were looking at mid-May, we'll send out another notification to everybody to let you know that that resource is also available for you. A couple of questions, I think we have time for a couple. Dr. Condeluci, where can we find resources on doing a cultural profile? Can you cover that, please?
Yeah. Actually, there's information on cultural profile in some of the books that I've written. I also have a white paper on my website that can walk people through it. But essentially, a cultural profile is really merely a conversation between two individuals beginning to discover who they are, what they care about, what they like, what they're interested in. It's very subjective. It's not an objective like assessment where, some kind of a, professional then analyzes the client. It's a conversation between two human beings about things they like and things they care about. And I have some recommendations for how the cultural profile should be conducted, but the simplicity of it is, you don't need a format, you don't need a clipboard. All you just need is an opportunity to be with somebody to begin to discover who they are and what they care about. And I would think that most people, especially direct support professionals who might be on this call, who are, with folks, hour after hour, and they spend a lot of time, have begun to really come to know who that person is and won't even need to do a cultural profile because they already know that person. But the key is to identify some of the things about that person and then really begin to say, where in our community, this is where community mapping comes in, where in our community might we begin to find a place for engagement, right? A setting, a venue that person can either join or find or penetrate into, where they can begin to meet people who care about what they care about.
Thank you. The other thing I will share, just because we're going to cut it close to time, if Dr. Condeluci's also offered to answer some questions offline. So if you can't get to your question during this live broadcast, please be reassured that we are going to collect the open questions and see if he can respond to us electronically, and then we'll also get that out to everybody.
Sure.
Thank you. So the other question that we had is, have you heard from anyone where the pandemic has actually created new opportunities for social connections? So for example, folks making masks for first responders, that's created some kind of like a phenomenon, right? Can you think of any other opportunities out there that's surfaced as a result of the pandemic?
Yeah, well, I think when we think about crises, not just this pandemic that we're in, but you can track back to 9/11 or other crises that we faced as a society. I think the key element has really been an openness about our common humanity that has really been the key. Robert Putnam, for example, in his book Bowling Alone, talks about the notion of joining, connecting, finding our humanity. And he wrote a piece after that book came out in the year 2000. After 9/11, he wrote a piece about how 9/11 brought out the best in our social nature as human beings. we cared about one another. We watched out. People gave blood. People, were doing things that they had heretofore not done that much of, right? So when you think about society, you think there's an individual side of society and a collective part of society. Individual, collective, right? And this is an interesting struggle, right? Take care of myself, take care of others, right? How do these two phenomena emerge or identify? And when do they skew? When do people just worry about their own butts, taking care of just themselves, right? Versus what can I do to help take care of somebody else? When Hurricane Katrina hit, there was an incredible outpouring of people wanting to help other people, opening up their homes, opening up their hearts, opening up their wallets, right, to try to support one another. That is the spirit of community, right? And that this idea of communality is really, really powerful. And I think the pandemic has touched that. It's caused people, I talked to my son in New York. He lives in New York. He works in advertising. And I was talking to him yesterday, and it was about 7 o'clock. He said, Dad, I'm going to call you right back because I got to go out to the window and I'm going to bang some pots. I said, what? He said 7 o'clock. Everybody is out banging pots, man, just to show our collective spirit for the caregivers, right? So that notion of touching people's heart, I think that's what we're going to reap. Now, thinking about it specifically, like, well, can we make masks, or what can we do? There's a piece of that, and I think we will have to be creative about that. But I really think this notion of post-pandemic communality that's going to be inspired will really be a wonderful, I think, stepstone for engagement. But Putnam tells us, though, that those things don't last long. He said after 9/11, there was this spike of communality, and then it began to drop. So that's my take on it, this notion of taking advantage of the communality.
Okay, thanks, Dr.
And I know we get going.
Yeah, unfortunately, there are some really interesting questions in the queue that I'm going to have to punt your way and see if we can answer it offline, because they're really interesting questions, but we have to conclude today's session. So I just want to thank everybody again. We had, like Dr. Condeluci shared, we had over 660 people register for this, which is amazing. I just want to thank again Robert Budd, our president of our board, for opening this virtual conference week, and then Al for kicking us off with a really thought-provoking session, and hope that to see a lot of you in the next session with our government relations team, and we'll be in touch with the follow-up material. So thank you, everybody, and have a good rest of the afternoon.